What's up, everybody? Let's talk hip precautions. Posterior hip precautions this time. Let's slap 2 minutes on the clock and let's get started. Precaution number 1 is excessive hip flexion past 90. It is important to make sure your patient does not flex or bend forward greater than the corner of that box. Pro tip, think function, not just angle. You have your patient sitting nicely at 90 degrees, they got to get out of the chair. Don't let them bend forward to get up exceeding 90. Fix that. You need to have them scoot forward so that they don't bend further than 90 degrees, or stick something underneath their chair to raise them up. Precaution number 2 is excessive hip internal rotation. Internal rotation is performed when the foot is turned in, or one foot is turned in towards the other. It is easy to have the patient avoid this when they're in the bed. However, pro tip, key thing is when they're walking with their walker, make sure they're not turning the walker and then their feet, because that causes them to internally rotate that hip. Make sure they are turning their feet, then their walker. This will cause them to effectively not internally rotate the leg when they're walking. The last hip precaution is hip adduction past midline. Hip adduction occurs when the leg crosses across the other leg. I'm sure we all know individuals who love to cross their legs whenever they're sitting in a chair or laying in the bed. But with this type of patient, it's very important that they don't do that. A pro tip, when the patient's getting out of bed, make sure they're getting up towards the side that they've had surgery on. That way they're leading with their surgical side, and that avoids them adducting or adducting across midline. So there you have it, all 3 posterior hip precautions. 1, hip flexion past 90. 2, no internal rotation of the foot. 3, do not cross the legs or adduct past midline. Hopefully, if you like this video, like or follow. If not, I'll see you in the next video.